India has the second largest COVID-19 caseload and infections are soaring. More than 168,000 cases were reported on Monday, and the start of a religious festival threatens to push the numbers even higher. Meanwhile, many hospitals are running out of vaccines, endangering one of the world's largest inoculation drives. Mobin Nasir reports.
Every year, millions of Hindus flock to the banks of the river Ganges. They believe bathing in it washes away their sins and protects them from harm. But this year, the festival is cause for concern for health officials.
We must recognize that packing together a large number of people, even in an outdoor situation, is likely to be an invitation for the virus to spread more easily.
After its first wave peaked in September, India's second wave of coronavirus infections is proving much larger. More than 1.37 million new cases have been reported since the start of this month. That's pushed the total number of infections to 13.5 million since the onset of the pandemic. The spike means India has now overtaken Brazil as the world's second worst hit country after the US. The federal government has expanded its inoculation drive to include everyone over the age of 45, but vaccines are in short supply. Last week, 700 vaccine centers were shut down because they didn't have enough jabs.
I had come here to get vaccinated, but they said they don't have the stock, so I'm going back home.
The Serum Institute of India, which is the world's largest vaccine maker, says a US ban on the export of raw materials is slowing down its production. That's impeding vaccination drives in other countries as well. The company has only provided 1/5 of the doses it had pledged to the World Health Organization's COVAX program, and AstraZeneca has filed a legal complaint against it for failing to keep up with demand. Officials in the worst-hit states in India, including Delhi, say the inoculation drives must be stepped up.
The terms and conditions are very tough. People under 45 cannot be vaccinated. We need to remove these conditions. We need to do the vaccination drive on a very large scale.
But the Serum Institute expects this shortage to last until July. That means the government will likely miss its target of inoculating 300 million Indians by August. It may also prolong the pandemic in many other countries. Mobin Nasir, TRT World.
Well, for more on this, Dr. Bharat Pankhania joins us now from Bath in the UK. He is a senior clinical lecturer at the University of Exeter Medical School. Welcome back to the program, Doctor. Now, as we heard, India is experiencing its worst surge of the pandemic so far, with a 7-day rolling average of around 130,000 daily new cases. Hospitals across the country are being overwhelmed, and some experts say the worst is yet to come. Why is India seeing the worst of the crisis right now?
So this is a clear example of infections happen and spread when you drop your guard. So when India was in its very strictly enforced lockdown measures, the case numbers dropped, as well as it restricting its tourism also enabled it to drop its case numbers. Then we've had important Hindu festivals where people get together. So the festival of Holi, the festival of taking the dip in the river Ganges, the Kumbh Mela, and generally people have started to drop their guards, and as a result, the case numbers have shot up.
Yes, and we saw some extraordinary pictures there of hundreds of thousands of Hindu devotees dipping in the Ganges River for that Kumbh Mela festival. And it is, I guess it's safe to recognise that some of these festivals are considered very sacred. In this case, the Kumbh Mela is one of the most sacred in the Hindu calendar. But how should authorities manage these events? If they're not prepared to cancel them altogether, what should they be doing?
I think you need to advise people that the virus doesn't respect any festivals or any religions or any persons. And the best advice possible would be from religious leaders, government leaders, all saying the one thing, which is nobody, no God is going to be angry with you if you don't come and have a dip in the Ganges this year. Your prerogative is to live well, be healthy, and fight another day. Therefore, if you can avoid coming to have a dip in the Ganges in 2021, please do so. It will save your life. And those messages are very important to get across. That is what we should be doing. Irrespective of which religion, there are many, many, many other gatherings, and all of these are vulnerable matters. And therefore, we give the same advice no matter which religion or cultural festivity it is.
Now, India is in the advantageous position of being home to the world's largest vaccine manufacturer, the Serum Institute of India. Yet we are seeing shortages of vaccines in several states across the country, including in Maharashtra, which is home to the country's financial capital, Mumbai. Why is it that a vaccine manufacturer like the Serum Institute could be experiencing shortages right now?
So it has got several contracts to manufacture for different platforms of the vaccines. And unfortunately, in the middle of a global pandemic, international governments in other parts of the world act on their national interest. So we have President Biden in the United States, who has enacted a old 1950s act and said, the items that we need in the United States stay in the United States. So all of a sudden, there is a shortage, a decrease in supplies of essential pumps, filters, and reagents for the manufacture of the vaccines in India. And this is a global failing, which is what world leaders need to be doing, is to say, we mustn't fail. Therefore, we must allow these specialist reagents, equipment, machinery to be either manufactured under license in larger numbers or be given or be allowed to be exported. Otherwise, we see what we are seeing now.
Okay, Dr. Bharat Pankhania, we will have to leave it there, but it's always good to get your analysis on the program. Thank you again.